Good morning. My name is Dina Demelawi. I'm one of the pathologists in Children's Hospital of Eastern Ontario, and we'll speak about histology of bone. In a previous video, we focused on the bone matrix. In this video, we'll focus on bone cells. So, bone have four important types of cells associated with it. From the first video, we identified that bone is characterized by pink matrix. So you can see this pink matrix characteristic of bone. When we look, we'll leave the pink matrix and we'll focus at the edges of it. And when we look, we identify this purple rich cells surrounding the bone. It's even taking its curvatures with it because it's just one cell thick but going along the length. So one row, each single cell in a row, but going through the length of the bone. And these are osteoblasts. Osteoblasts are bone forming cells. They are the only cell in the body that can form osteoid, which is formed predominantly of collagen type 1 and which is the organic matrix of bone. Osteoblasts are characterized by being an oval cell, like an egg-shaped. The nucleus, and we said in the previous video that we identified the nucleus as purple stained by its purple staining. And we can see the nucleus is on one side of the cell. Here is a nice osteoblast, and we can see the nucleus is at one side of the cell, while the pinker cytoplasm is on the opposite side. So the nucleus on one side of the cell, we call it polar nucleus, because it's on one side of the cell or one pole of the cell. The black arrows here are highlighting osteoblasts, which again are cells that form osteoid, which represent the organic component of the bone matrix. We can look and find that these osteoblasts, all almost twins, they are similar in shape and looks, and even in the chromatin staining, so the nucleus is staining purple even the same. And that's what characterizes osteoblasts when they are reactive or in a benign tumor. In a malignant tumor, they will become more blue, and we'll speak about this in the workshop. Osteoblasts are characterized by their function is to put osteoid and form bone. When osteoblasts finish their function, they have three fates to go to. They either die by a process we call apoptosis, which is single cell death. So I finish my function, I put the bone, I put the osteoid, and then I die. So because not all cells will die, they have three fates. So some of them will undergo individual cell death, which is apoptosis. The second fate of osteoblast is to change to a flat cell that line the bone and sit quiescent until there is an impulse to tell it to wake up. We will start a remodeling process. This is called bone lining cell, and we have shown these flat cells on the surface of the bone in a previous video. The third fate for an osteoblast is to become embedded and enmeshed and incorporated within the osteoid they are secreting and become part of the bone and change to osteocytes. So here we have inside the pink matrix, not on the surface, inside the pink matrix we have cells. Some of them I highlighted with the blue arrow. These are osteocytes. These cells were originally osteoblasts that become incorporated and enmeshed with the collagen type 1 an osteoid is secreting, and when the mineralization happens with calcium and phosphorus, crystallize inside the collagen to form the bone, they are captured inside. These are osteocytes. Osteocytes are characterized by being predominantly formed of a nucleus and long cell projections, which we call it processes. In our sections, we don't see these processes because they are very tiny, and they actually goes in spaces inside the bone matrix that we call them canaliculi. And osteocytes connect together. So this osteocyte actually connect with this osteocyte, connect with this osteocyte, they connect together. So they are communicating together. They communicate as well with the bone surface cells, and they communicate as well with the endosteal surface of the bone. So what's the endosteal surface of the bone? It's the inner side of the periosteum, the inner lining cells towards the bone marrow cavity. We call it endosteal side of the bone. So they communicate even with what's happening outside the bone. They are very important cells in keeping calcium and phosphorus homeostasis. So osteocytes are very receptive to impulses to say, oh, the calcium is low in the blood. If that's the case, then they give a signal that we have to eat part of the bone, so we release the calcium to go in the blood to return the calcium level to normal. So they are very important cells for calcium and phosphorus homeostasis. Again, these are osteocytes. Osteocytes on morphology, the clue for them is that they are surrounded with the pink material, which is the bone matrix. The other clue, they sit in a white space. So you can see here is an osteocyte, and there is a white space surrounding. This space, we call it lacuna. So osteocytes sits in a space within the bone matrix. The space, we call it lacuna. Each osteocyte is surrounded with a space with a lacuna. So again, to summarize, this is an image showing a reactive bone. So this bone is reactive. It's in the process of forming bone. We can see the osteoblasts lining the surface of the bone. We can see the osteocytes inside the bone, and we can see the pink bone matrix. Now we'll get to introduce to number 4th type of bone cell. So we spoke about bone lining cell, we spoke about osteocyte, we spoke about osteoblasts. Now we're speaking about the 4th type, which is osteoclasts. So osteoblasts form bone, osteocytes communicate with outside to give signal, release bone, break bone, or put bone. If calcium is high, make more bone, right? And we said bone lining cells, which are just flat on the surface of the bone, and they are just sitting there until there is a signal from the osteocytes. Let's start a remodeling process, or let's a remodeling process, yes. And then the 4th type is the one that's capable of eating bone. So no cell in the body can eat bone. The tumor cannot eat bone. An infection cannot eat bone. The only cell that can eat bone is osteoclast. Osteoclast. So what happened with the tumor, what happened with infection, what happened even with the fracture to eat the dead bone in a fracture, the osteoclasts come and eat it. What happened with the tumor to have an osteolytic lesion of the bone, the tumor gives impulses and cytokines and other transmitters to activate osteoclasts to come and eat the bone. What are the characteristics of osteocytes? So, if we look at this image, let's identify the anatomy or the histology we have first. So first we have bone. This bone is in a child because I can see it's pink, but still have the purple centers which represent remnants of the cartilaginous skeleton, which started in the fetus and continued through infancy and as early as 5 years to become changed to bone. We can see the black arrow highlighting cells, just one row and lining the bone, and these are the osteoblasts. But we can see a red circle and have a bigger, much bigger cell. Compare the size of one osteoblast to the size of osteoclast. Osteoclast is almost like, 20 times more? And also, osteoclasts contain multiple nuclei, so it's a big cell. And in contrast to osteoblasts and osteocytes, which each have one nucleus per cell, osteoclasts have multiple nuclei. So in this cell, we have 5 nuclei inside the cell. This is osteoclast. Okay. Again, this is a bone matrix and a piece of bone and arrow highlighting osteocyte over here. Many osteocytes, and we can see the concentric lamellae and that the osteocytes are rotating around. Let's return to our osteoclasts. So this is an area of bone. I'm highlighting over here the bone, and then there is several osteoclasts. 1, 2, 3, 4. These osteoclasts, as I mentioned, they are bigger cell, much bigger cells compared to the osteocyte size that are highlighted by the blue arrow. The osteoclasts are much bigger, and they contain several nuclei. This one contains 1, 2, 3, 4, 5, 6 nuclei, and maybe actually 7. This is the rest of it. So big nucleus. The other characteristic, look what they are doing in bone. They are doing resorption of bone. So they are eating bone. And as they are eating bone, they create an invagination in the bone, which we call it house-shaped lacuna or resorption bay. So as they eat, they just burrows and burrows in the bone to do an invagination. And that's why, in contrast to what we usually see in bone, it has to have a smooth contour. In areas of remodeling, in areas where osteoclasts are active, the bone contour is jagged, is having this irregularity or this invagination, which represent the resorption bay or represent the house-shaped lacuna that caused by these osteoclasts that are eating bone. Osteoclasts have the ability to secrete acid phosphatase, which dissolve the calcium and eat bone. All the osteoclasts in this field I highlighted with the black arrow so you can see them. So, to summarize, the remodeling process of bone involves 4 cells. Osteoblasts form osteoid and form bone. Osteoclasts eat bone. Osteocytes, maestro, that is in control of the calcium phosphorus homeostasis and for signaling of remodeling processes, and bone surface lining cells, which are involved, but the role is not 100% known. One thing just to remember about osteoclasts is that in contrast to osteocytes, which comes from osteoblasts, and osteoclasts, they come from the bone marrow. They come from hematopoietic cells. They come from the stem hematopoietic cells. This is another picture, again to show osteoclasts highlighted by black arrows and osteocytes as highlighted by blue arrows, and we can appreciate the irregularity in the bone caused by the eating of the osteoclast. This is a case of a patient that I got a bone specimen from, and there was a question on what's wrong with this bone. And the first thing that comes to my eye, there is tons and tons of irregular bone, and this is caused by a lot of house-shaped lacunae, which means that there is increased activation of osteoclasts. There is only one osteoclast captured in this field, and I highlighted with the blue arrow, but as I look through the bone surface, I know there are many osteoclasts. They are not captured in my 4-micron thick section, but they are next door because I can see their effect with doing all this lacuna, house-shaped lacuna, and all this resorption phase in the bone. One thing to remember in remodeling process is that osteoclasts are very efficient. They can create a hole with that's one osteoclast can create. It needs up to 20 to 30 osteoblasts to fill. So osteoblasts are very slow compared to osteoclasts, and this is important to remember, especially when we, in the workshop, when we start with Dr. McDonald on metabolic bone disease and diseases like osteoporosis. To understand really what's happening, we have to keep in mind that generally osteoblasts are not efficient as osteoclasts. And it takes a lot of osteoblasts to fill one hole that's made by one osteoclast. This is, we're now finishing the video 2, and I put this section because when we look at bone, we will find all these cells going together, and we have to interpret them all together. So when we look here, as highlighted by the arrow, we can see osteocytes in lacuna. We can see on the surface osteoblasts, we can see the bone marrow, and we can see the bone spicules with the bone matrix. So when we look at sections in pathology, and we won't look at one cell, we'll look at the whole section, which have matrix cells, surrounding milieu, which is in here bone marrow. We have to be able to interpret all of it together, to put it together. So, as I did with the previous video, I'll put a quiz. So, question. Where is the bone matrix? So, is it here? Or is it here? Or is it here? Number 2. What are the cells highlighted by the black arrows? Third question, what are the cells highlighted by the blue arrows? What do we call them, and what is their function? Now, image 2. What is the name of the cells highlighted by the blue arrows over here? All of this. And what is their function? What is the name of the cell highlighted by the black arrow, and what's its function? What's the name of this cell that have in its center this star? What do we call this white globule? And then the last question, is this section from an adult or a child? And the last question, just to make sure we put it all together. So this is a bone spicule or piece. And my question, what's the name of the cell highlighted by the yellow arrow? What's the name of the cell highlighted by the blue arrow? What's the name of the cell highlighted by the green arrow? What is the question mark? What do we call this matrix? What type of matrix is it? And belong to which tissue? And what's the name of the cell highlighted by the black arrow? We can have the yellow and black same type of cell, so don't get confused. Okay, And this image I put already in the previous video, but just as a reminder, what do we think of this bone? Is it a lamellar or woven bone? And this ends my second video. Now we'll move to video 3 and 4.